Hi, I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I'll be taking you through today's Bolder Healthier Workplace Champion webinar on mental health. So we chose to do this this time of year because winter is a time often when we see more people struggling with their mental health, and there are several different reasons that this can happen. There is a thing called seasonal affective disorder. It affects around 2 million people in Britain, and that's when there's less daylight, people's mood drops, and they get more likely to experience depression. But it's also because at the festive season, this time of year, people often feel lonelier. They are reflecting a bit. That reflection isn't always positive, and often people dwell on individuals they've lost or difficulties with their family. So it can be quite a hard emotional time, and that often can link to a very low mood, and sometimes that can become a mental health issue. People also often struggle with debt during the festive season, and there's a longer payday between your December paycheck and your January one, so that can cause an issue, particularly at the moment with the added cost of heating and the cost of living pressures. So there are plenty of reasons to be a little bit more alert and a little bit more switched on around mental health at this time of year. So I thought we'd start with a short video from mine to just help us all get on the same page around what do we mean when we talk about mental health. It's only a minute or so long, so do have a watch and a listen.
We're here to make sure everybody with a mental health problem has somewhere to turn for advice and support. In the past, people thought if you had a mental health problem, you would never feel better. You might meet people who still feel this. Maybe you feel this way about yourself. Mental health is just like physical health. Everybody has it and needs to look after it. You have good mental health if you're able to think, feel, and react in the ways that you need and want. You might need support with your mental health if you are finding the way you're thinking, feeling, or reacting is more difficult or even impossible to cope with. This might be because of things that are happening in your life right now. A traumatic event may affect your mental health in a big way too, even years later. We are all different. Everybody experiences a huge variety of feelings, thoughts and emotions as part of their normal life. But how and when we have them can be really different depending on who we are. Some of us can find these harder to cope with. This can be because of our upbringing and childhood, past experiences, or the things happening in our lives right now. That's why it's important that only you, someone who knows you really well, or someone who is qualified, gets to say when you need help. If your feelings, thoughts and reactions are getting in the way of how you want to live, if you feel things aren't right, if you feel like you need help, you can ask for it. We're not going to pretend it's easy. Mental health problems can change your life, and for some they can be overwhelming. But that's why Mind is here. We're going to face it with you. We'll listen, give support, and fight your corner. To find out more, visit mind.org.uk.
So hopefully that little short video just gave you a bit of sense of what we're talking about when we talk about mental health, and apologies for the little glitch in the middle of that short pause. When we're talking about mental health, we're talking about people's ability to think, their behavioural state and their emotional well-being, and all of those things play a part. And poor mental health can affect us in all sorts of different ways, but it also interacts with our physical health. And the reality is you can't have good mental health without good physical health. And it's very hard to have good physical health if you haven't got good mental health. And there's a real overlap between the two. So looking after someone's mental health is just as important as looking after their physical health. Later on in the presentation, we're going to use some of the resources that were developed by Business in the Community with Public Health England to support organisations in taking action on mental health and wellbeing. And this is just a little section from that toolkit. And it highlights actually that mental health in the workplace is really important. And when you kind of think about it, it feels kind of obvious. If you're not in a great state and your mental health isn't good, you're not going to give the best to your job. You're not going to give great customer service. And we know that mental health is one of the big reasons for sickness absence as well. So it's important to employers and for line managers to take mental health seriously and really see what we can do to support our staff and our organisations to be mentally healthy. And BITC pulled together this infographic, which just sets out some of the figures from research which was back in 2017. And they do this national survey on mental health at work pretty much every year. And sadly, the figures only get worse rather than better in recent years. But the cost to employers of mental health is really high. So it's not just about important in terms of the workplace because people are suffering and they've got a health issue that we can help with, but also because it has a direct impact on industry. It has a direct impact on the organisation. And we know that in organisations that actively address mental health issues, that create mentally healthy environments, that generally have lower sickness absence, better staff satisfaction, better customer satisfaction. And it's a kind of virtuous circle. Once you start doing it, actually everything starts to get better. So it's really worth lobbying and working with your workforce in your workplace to make an impact in this space. There are a couple of key terms and we've included them in the slide. They link back to the toolkit around definitions, but we thought the video gives it a little bit easier and makes it a bit more straightforward. One of the things that you'll hear quite often in workplaces is that term mental health and then mental well-being and how they kind of interact with each other. And mental health is like physical health. It's our state of mental and psychological well-being. Well-being is really about how we feel in terms of how we feel around our relationship with our life, our social connections. So well-being is a little bit more subjective than objective. And mental well-being is described as a kind of dynamic mental state. It's how we feel confident in ourselves, so it links into self-esteem, how we're able to express ourselves, express our emotions, how we build relationships, living and working productively, and how we adapt to some of the stresses of life. We're going to talk in a little bit and share a short video in a little bit about stress, because particularly in the workplace, work stress is a term that's used a lot. And we know that stress in itself is not often considered a mental health clinical condition, but it can impact on your mental health, and particularly long periods of stress often do wear down someone's mental health and lead to clinical conditions like anxiety and depression. So it's an important thing to think about, and the video I'll show you in a second will talk a little bit more about what is stress. The other term that often you'll hear in this kind of space in workplaces is around presenteeism. And that's really a term that says people who turn up to work when they're sick and they should be at home. And because they're sick and they're still at work, they're not doing their full job. They're not able to perform to their full ability. And presenteeism is often something we see quite a lot when it comes to mental health issues. So now let's go on to the video, which will show you a little bit about what it means when we talk about stress. And I think it's quite a nice video to give you a bit of an understanding about the term stress and what it means to us. So here's the video. Oh, I went to the end of the video before I started it. So let's replay it.
There are times we all feel under enormous pressure, like when you have a million deadlines and not enough hours in the day, or when the kids need to be taken to football practice and you haven't cooked the dinner, or when you're studying for exams, or when a friend or relative becomes ill. We can also go through traumatic events that knock us sideways. At times like these, we can start to feel overwhelmed or unable to cope. That feeling is often called stress. Stress has been a part of life for thousands of years, and a certain amount of stress can be a good thing. But when stress gets out of control, the consequences can be serious. Stress can be a key cause of anxiety and depression, and is sometimes linked to self-harm and suicide. It can also have serious physical impacts. Stress can increase the risk of heart disease. It can affect our ability to get to sleep and stay asleep. It is linked to muscle pain and can damage our immune system. We know we are too stressed too often. Our polling has shown that over the past year in Britain, almost 3/4 of people have at some point felt so stressed they felt overwhelmed or unable to cope. 2/3 of us experience a mental health problem in our lifetime. But it doesn't have to be this way. By tackling stress, we lower the risk of future mental health problems. But how can we do this? We can start with you and me. Try to think through what is causing you stress and how it could be managed differently. It may help to get a bit more physical exercise. Going for that walk or swim helps balance life. Exercise is a proven way to reduce stress. You could try reducing drinking and smoking, which can make problems worse rather than better. Take a break. Even short breaks from work or a person you find difficult can help manage the stresses and strains of daily life. Try a few minutes of mindfulness each day. We know from research that mindfulness is effective in reducing stress and anxiety. But we can also do things as a society. We're calling for businesses to support better work-life balance and tackle work-related stress. We're calling for schools and teachers to work with children to ensure that stress isn't stopping young people from thriving. And we're calling for better support for society's most vulnerable to reduce the stresses caused by poverty, poor housing, and social isolation. See how stress is affecting your life. Take a stress test now at mentalhealth.org.uk/stress.
So hopefully that video just helps give a little bit of a sense of what we're talking about when we're talking about stress, and also some really helpful hints about what you can do about it. So I thought that was a useful one to share just before we go into what the ask of you of Workplace Champions is from this webinar. So first of all, we've included in the slide deck information of what to do if you come across someone in mental health crisis. As champions, we're not training you to be mental health professionals. We're supporting you to have conversations, to connect people to support, and to feed back to us a bit about what can we do better to support people's mental health in the future. So it's useful to include this information. We thought if you do come across someone in crisis, please do help support them get help immediately in the same way you would do if someone was having a heart attack or a physical health emergency. So what's the ask of you in this context? Well, first of all, let's talk about mental health. Talk about your own mental health, talk about mental health in the workplace, talk about mental health with your colleagues. The more we can talk about mental health, the less stigma there is, and the more likely people are going to reach out for help when they need it. We're going to talk a little bit in the webinar about how to connect people to support, and I'm particularly going to focus on what employers can do and what can be done in the workplace. And then, of course, the ask is to feed back to us about where we can be better and where we can play our part, supporting you and your workplaces to be mentally healthier spaces. So first of all, talking about mental health, the impact it has on you, your colleagues, and in the workplace. Keep in mind that the focus is on providing the approved information, and being aware that you shouldn't receive personal information for individuals. It's always worth talking to your occupational health department, if you have one in your organisation, to find out what are the local referral pathways, what's the support that your business offers your staff. And if there isn't support, then use some of the tools in this webinar to open up that conversation. This is a really nice slide, I think, in terms of describing how you can support a colleague if they're having a difficult time. One of the challenges we have around mental health is that people still carry a lot of stigma and a lot of shame around disclosing when they have trouble and issues. And really, this is a time to practice those active listening skills, listening carefully to what people are saying, acknowledging it, being open, keeping eye contact, but also recognizing their body language, asking direct and appropriate questions, and then making sure you can connect them to support if they need help. Plan your chat. If you know someone's struggling and you want to reach out to help them, think about how are you going to do it, where you're going to do it, how, what's appropriate. Because often when we know one of our colleagues is struggling, we know that's going on. We've just got to plan the time to have the conversation. It's also important in this space we look after our own mental health, that of others. And these are just some useful tips when you're thinking about your own mental health, about things that can help you if you're starting to struggle. So that's included in the pack for you as well. Some of the signs to look out for, and when you think about is someone in distress, might they be developing a mental health issue? Obviously there are those kind of standout signs that people who look very disturbed or distracted, but often there's more subtle signs, people becoming more withdrawn, shut down, a bit more fidgety or restless than usual, perhaps being a bit overexcited. having some illogical behaviours, repeating themselves a lot, or obsessing over things. All of these can be signs of mental health issues. And remember, as champions, you're not mental health professionals. What we're asking you to do is open a conversation and connect people to support. So let's talk about how you might do that. So hopefully you're familiar with this approach of the 3 A's, the ask, assist and act algorithm. This is a model which we know works. It's a good way of opening the conversation using open questions. How are you? It's a question that we often ask, but we don't really listen to the answer. Expanding on that a bit more to ask, how are you feeling at the moment? What's been going on in your life recently? All of these can be open questions that can help you open up a conversation to understand where someone is. And then if someone starts to give answers that concern you, or you start to probe a little bit further, if they mention something, you mentioned you're feeling a bit low. Is there something particular going on? Would you like me to help find some services? I do this thing called Boulder Healthy Champions. Got some ways of finding out support that's available. Can I help? How can I help? Often when people are having issues with mental health, actually finding someone that they can just talk to is a really big help. But connecting them to services and to people who are trained to listen and trained to recognise the signs when things are getting more serious is really important. So there are links in the slide pack for you about how to respond to that. Similarly, if you can have someone who's looking very tired, asking that question, how are you? How are you is this amazing phrase that we discount its power in interactions. And certainly in my own practice at work, when I'm supervising staff, when I'm doing those regular one-to-ones, I usually start with, how are you? Because you get a very good sense at the beginning of that one-to-one interaction where someone's at, but also it gives them a space. If there is something on their minds, they can get it out, and that we can then spend the next hour talking about that rather than necessarily their performance report, if that's what they need at the time. If you leave the how are you till the end of the meeting, then you're trying to cram in. Someone might disclose something. You've only got 2 minutes before your next meeting. So think about how you integrate this, perhaps particularly if you're a line manager, into your regular supervision. There are other ways you can do this if you manage teams. In my own role in the council, we use a mood escalator. So we have a list of terms. Are you feeling happy today, stressed, anxious, enthusiastic? And we use a tool called Menti, which is like an anonymous survey tool. And at the beginning of the meeting, we ask people to select the term that most describes their mood at the moment. And then we do the same thing at the end of the team meeting. And that gives a sense of where people are at in the room. And that means I can adapt or change the agenda a little bit. So if everyone's feeling a bit low, I might be a little bit more upbeat, or I might create a space in the agenda to kind of get some things on the table. But if everyone's super enthusiastic, again, I might tailor the meeting a little bit differently. So there are different ways of having the how are you conversation. It doesn't have to be just one-to-one. You can use it in teams as well in your workplace. So then thinking about how do you connect people to support, and there are of course the helplines, and in the pack that you've received in the newsletter as champions, there's more detail on helplines, particularly also detail on helplines to support people with some of the things that might be driving particularly stress and anxiety or depression, issues around financial security, bereavement. So there's more detailed helplines in the resources we've given you outside of the webinar. But I wanted to focus on some of the elements that are specific for employers. And this is a checklist that comes from the BITC toolkit. And it's a really simple one in the sense that these look like straightforward things to do. I know, having worked in several organisations who've used the toolkit, some of these things sound really straightforward, but actually making them real at every level of the organisation does require really hard work and real commitment from the business. And that's why the first thing is about making sure you've got senior level buy-in and you've got a senior mental health champion. So it's a really useful tool to use to start to build your approach in your workplace. There are other resources available, but I'm going to use this one and also Mental Health at Work website through the webinar today, but we've included those links in the presentation for you. Time to Change is another good tool that can be used for employers. We know in many spaces that employers love a charter mark or a pledge or something that's visible that helps them move forward. And Time to Change Employer Pledge was introduced over 10 years ago now as a tool to support employers to develop action plans for change. And although the approach isn't live anymore, Time to Change was stood down in 2020. The resources are still available, and it's a really good tool to just use and also to see what others have done, which I think is brilliant, because often if you're a workplace that's in the early stages of trying to think about this, it can be quite scary ground. So actually learning from others and seeing what other people have done is a really brilliant way of doing it. And there are lots of employers in Birmingham who've already used the Time to Change pledge to take action. So you can always reach out to them as well. There is national guidance from NICE, the National Institute for Health and Care Excellence, which is evidence-based guidance specifically for health and wellbeing at work. So if you have an occupational health department or you have someone who's particularly techie and research minded, NICE is a great way to get them on board. And on the Mental Health at Work website, which is a national resource curated by Mind, there are some brilliant resources as well, particularly also some things around how to make your workplace autistic friendly, coping with loneliness, being an anti-racist organisation. So there's more than just in inverted commas, clinical mental health information there. So another short video that will just give you an example of what a mentally healthy workplace is like.
You come in the morning and you think to yourself, why am I here? And then you go home and you feel physically sick because you didn't know what you were going to walk into. My name's Kurt Robinson. I'm an Associate Director within MACE. My role is making sure everybody goes home the same way they come in the morning. I've got one daughter, Holly. Love her a bit. She's my best mate. Dads and daughters, they always say, are very close. At 13 years old, she's 13 stone. She developed an eating disorder through being bullied at school. When I looked at her again, she's 5 1/4 stone. And I allowed that to happen to my best friend. All the while this is going on, I'm still coming into work. It was very, very difficult. I was here physically, mentally, I was all over the place. You do not want to get up in the morning, you don't want to talk to anybody, you know you've got to go out, you know you've got to earn some money. Construction's always been seen as a very macho culture. Get on and deal with it, man up, grow up here if you like. It doesn't matter what industry it is, there is always a stigma attached with mental health. My line manager thankfully did say to me on several occasions, he said, if you don't want to come in, he said, just send us a text and say, I am not coming in. If I hadn't had that support network, I swear, as God is my witness, I would have done something ridiculous and ended up as a statistic. I've started carrying out a lot of mental health awareness toolbox talks. It gives me the opportunity to get the guys to talk to one another and to talk to me, and then recognise that if they have got a problem, they're not on their own. The Mental Health at Work website pulls all these resources together so that if you just go on the website, filter it by your industry, and then that will give you or your line manager resources to point you in the right direction and to help them to support somebody that is struggling. In the words of the sainted Bob Hoskins, it's good to talk.
So what a great plug for mental health and work resources, but also really powerful testimony about how we can make a difference. There are organisations that are doing really good work in this space. Another example of this is taken from a case study of a local council in the West Midlands who've been using the health and safety executive stress management standards as an approach and really working with managers on how to support using that tool to assess a role and to look at how can it be made less stressful for the individual delivering it. There are resources also about the 5 ways to wellbeing at work, and there's plenty of resources and support there, but some of those link, I think, more to other webinars, but we included it as just a prompt, a reminder as well. The final ask of you as champions is to feed back to us. One of the things we really want with the Champions programme is for it to be a two-way discussion. It's not just about us giving you this massive brain dump of information. It's also about you telling us how it feels out there with the people that you work with, where you're putting this into practice, and what would be useful for you in the future. We will undoubtedly do other webinars and sessions on mental health in the future. So this is a really important opportunity for you to take these tools, to take what we've shared today, put it into practice and go, you know what, this is what I still need to know about. This is how you can improve it for next time. So thank you for being a Boulder Health champion. Thank you for working with us. Please spread the word. The more champions we have, the more we can do to improve the health and well-being of the people that live, work and play in Birmingham. And thank you for your time watching this webinar. I hope you've enjoyed it. It's a really important topic and one which we hope will really make a difference in people's lives. So please go out and use what we've given you today and make a difference to create a mentally healthy city in Birmingham. Thank you again.